Our next speaker is also comes to us via tape, but Dr. Jeff Elison has delivered a very interesting discussion of some of his research. He is a PhD psychologist at Adams State University in Western Colorado, and he's going to talk to us about the unexpected bad outcome and the compass of shame research.
I'm Dr. Ellison, Dr. Jeff Ellison. I teach at Adams State University in Colorado, small town here. And I've been doing research on self-conscious emotions for many years now, 22 years or something like that. So that's the topic for today, is self-conscious emotions and how we self-regulate or cope with those emotional experiences. And as you'll see, I approach pretty much everything from an evolutionary psych perspective. And that's the way I'm going to start here. I know that shame and those self-conscious emotions can be tough ones to talk about. So I want to kind of break that hesitancy a little bit by talking about anger. From an evolutionary perspective, we often talk about emotion families. And the idea here is that if you look at irritation through rage, these are all one family of emotions. They have similar antecedents or causes. They have similar physiological reactions, similar psychological reactions, and similar behavioral reactions. So we see these as one big unhappy family. And we can do the same here with the shame family. So I'm going to use the word shame over and over again, but I'm really talking about this more broadly, including embarrassment, humiliation, and even guilt, even just self-consciousness. So I know that there's a joke that we're ashamed to talk about our shame because, if you ask somebody, what are you ashamed of? You're basically asking them, tell me something terrible about yourself or something bad, something that you don't want to share. But it doesn't have to be that way. And I'm going to pursue that angle. So again, I'm talking about shame broadly, and I am talking about it as an evolutionary adaptation, just like anger helps keep us alive and socially connected and reproducing. Same thing with these self-conscious emotions. So the point here is that they're not completely distinct. These are fuzzy concepts, meaning they don't have hard boundaries between them. We often use the words kind of interchangeably. Many people kind of debate what's the difference between shame and guilt. Are they the same thing? And we don't need to get into that debate. But people often use two terms at once. Oh, I felt guilty and embarrassed, as an example. And what they have in common in terms of the antecedent is what Cooley, writing in the early 1900s, called the looking glass self, old term for a mirror, for those of us who are old like me. And the idea here is that we see ourselves, the image we have of ourselves is often reflected through the eyes of other people. So Cooley said there are several parts to this experience. There's the imagined image in the eyes of the other. So unless you tell me what you're thinking, I don't quite know how you're seeing me, but I can imagine, oh, I'm doing well, I'm doing poorly, I missed that goal in sports or made some other mistake. And then we know that we make judgments about other people and other things constantly. It's just part of human nature to constantly be evaluating this is good or this is bad. So there's this imagined judgment. You see me one way, and I imagine how you feel about me then as positive or negative. And along with that comes the self-feeling, either shame or pride. And Cooley had a very sophisticated perspective on this. He thought that shame and pride could be so mild that we might not even be conscious of them, and thought that in a lot of ways, in social contexts, that shame is the master emotion. It's always there. We're always wondering about how we're doing when we're around other people. So when we look at the function of shame, why would we have evolved to have shame? How can it be adaptive? How can it be maladaptive is where I want to head now. And there's a whole body of literature that's growing around this idea of social pain. So shame is a form of social pain. And if you look at our normal pain system, which doctors are very familiar with, it's, indications of injury or illness or, something that needs attention. Same thing with shame. It's a social injury or a relational injury. So my best friend thinks less of me because of how I treated them, or, didn't return something, or I've made a mistake when I'm teaching in class. And there's that perceived evaluation that people think less of me. So again, injury to the body, injury to social relationships. The feeling, we have physical pain that we're all painfully familiar with, pun intended. But we also have emotional pain, or as I said, now it's commonly called social pain in the literature. And at this point, I got rid of the two columns because they function almost exactly the same way. And in fact, there's quite a bit of evidence that they rely on some of the same systems in the brain. The evolutionary explanation would be that almost every animal has some sort of physical pain system, and that this is an exaptation. So through evolution, we've sort of morphed the physical pain system to function under social pain. So when you feel left out or something like that, we often use pain-related words like my feelings were hurt, right? Or I was crushed, things like that. So, and that is because, again, social pain elicits some of the same physical pain reactions in the brain. And what happens functionally is that our attention is directed to the problem. If I touch a hot stove, no matter how interesting the conversation I'm having, my attention is directed to that. If I'm having a conversation with somebody and they look at me in a very disapproving manner, suddenly my attention is directed to the problem, just like the hot stove. They motivate the same behaviors. I quit leaning on a hot stove and I quit saying whatever I've been saying that makes you disapprove of me. If I can repair the injury to my hand, I do that. If I can repair the injury to the relationship, I do that. I might apologize. I was just kidding. If I was looking stupid, I may try to look more intelligent. And this is one of the things that makes them so hard to understand sometimes, is that they really shape our behaviors through future avoidance. So we learn to turn the lights on rather than stub our toe, and we learn to avoid certain topics in conversation, or where you wear clothes to work. We largely, our behavior in many, many ways anyway, is shaped by both physical pain and the pain of shame or social pain. So the message there is that it's adaptive. It allows us to maintain our social relationships, the integrity of our social relationships, even our social standing or our status, just in the same way that physical pain allows us to maintain our bodies. So shame can be adaptive, but it's been associated with a lot of bad outcomes, depression, down to anorexia, suicide, a whole host of problematic outcomes. And the literature used to really be focused on that, these negative maladaptive outcomes we see at the bottom right, but I've just made the argument that they lead to positive and adaptive outcomes as well. And what seems to matter the most is not the experience of shame or embarrassment, but how we deal with it, how we cope, or Freud would have said defend, but we don't need to go there, but very similar to coping or emotional self-regulation. So the literature has noted a number of responses. It might be anger. I'm angry at other people for putting me down or putting me down for incorrectly. I may feel stupid myself and sort of internalize that message. I may just want to get away from people. You wish you could disappear, the ground would just swallow you up. And that makes a lot of sense from Cooley's perspective of this looking glass self. Your eyes are what make me feel bad, that judgment that comes through you. And then other times we just sort of laugh it off and don't take it seriously. I got dumped, but I was going to dump her anyway, or I failed a class, but it was a dumb class. Actually, that would be kind of the outward directed anger. And all this has been captured in what Nathanson calls the compass of shame, which you can see for obvious reasons why it looks like a compass, these 4 different styles that I've just talked about. And I will go into a little bit more detail on those. But the bullseye would be to stick with this just like any emotion and recognize what you're feeling and say, why am I feeling this? And maybe there's no reason for it. Somebody is disapproving of you because you like Britney Spears or whatever. Well, who cares? And, you can ignore that. But other times we don't do that and we stray along one of these directions, or sometimes more than one of these directions. So in withdrawal, we feel bad. And that goes back to us being ashamed of shame. People rarely say, I feel ashamed. And instead, I just feel bad or bad about myself. But withdrawal is sort of an internalizing procedure, meaning we internalize the message and that feeling. So we sort of accept that we're less worthy. The motive is to reduce that emotional pain. So again, we might just try to get away from other people, wish the ground could swallow us up. We withdraw from people or we hide. Attack self is closely related. It's also internalizing, but we magnify that bad feeling. We might blow it out of proportion and get angry at ourselves or self-disgust, even if it's a small mistake that we've made. Might think I'm stupid, I'm incompetent. Again, probably magnifying it. But we don't want to be. We want to be accepted by others. So we might show deference. We might suck up to people who are higher on the totem pole than us. We might make massive efforts to improve. Sometimes this drives perfectionism. Attack other, we just reverse that anger and direct it out toward other people. So I look at other people's faults. I want to bolster my own rank. So a student who's done poorly, that drops you on the totem. You're a C. You get a C on this exam. You may look around quickly and look for people who got a D or an F, somebody who's doing worse than you. So some of the behaviors are to externalize, just the opposite of the others. We want to externalize those feelings by blaming other people or perhaps putting other people down. And then avoidance is fascinating. Freud called this denial, although there's more to it than that. And often people say, oh, I feel fine. It's fine. I don't care. You flunked the test. Oh, it's fine. Right. So they want to eliminate the conscious feeling of discomfort. Avoid feeling that emotional pain is the motive. There are lots of ways people can do this. This is the hardest one to assess sometimes. So I could disavow a goal, like, I flunked out of chemistry for my major, but, I didn't really care. Turn to distractions, drug, sex, rock and roll. It's my standard joke with my students. Or focus others' attention on my strengths. Look at the beautiful car I'm driving or something like that, as opposed to your weaknesses. And again, shame is adaptive and all of these are normal. If you look around, if you look at yourself, you probably do every one of these every single day to some minor degree. The more you study it, the more you see it. Anytime I see anger, I see a parent getting angry at a child in the grocery store. Well, they're angry that the kid's not cooperative and making a scene, but they're also angry because that scene makes them look like a bad parent. So we've done a lot of research on maladaptive outcomes related to these. Low self-esteem, depression, anxiety, a whole bunch of things go along with withdrawal, and just in general, internalizing styles of reacting are hard on us. Attack self is the worst, at least on the surface. It correlates with more negative outcomes and usually more strongly. So it predicts depression better than withdrawal does, low self-esteem, perfectionism, and quite a few other things. Avoidance, you're laughing it off, you're pretending you're not dealing with it. So somatization, like psychosomatic symptoms, grinding your teeth or, upset stomach, headaches, from trying to bottle that up. Interpersonal sensitivity, you might react too strongly to somebody's comment. That's an interesting shirt. What do you mean it's interesting? That sort of thing. Substance abuse, of course, is a common form of avoidance. And then I have this in large letters because often I focus on the hostility and violence that shame can breed. And I've actually got several publications about that. If shame makes us feel pain, think about how you react when somebody hits you, or even if they accidentally step on your foot, you might immediately jump to an anger response. And that's probably pretty hardwired by evolution. And I won't go into that too much. But the implications are that we want to avoid the maladaptive outcomes and focus on the positive outcomes. So the first thing that you can do is really focus on your own experience and understand why you're feeling what you're feeling. Is there anything you need to do about it? And if you've made a mistake, can you fix it? So we can try to minimize occurrences, and we can try to turn to adaptive coping. So when we're working with other people, we can try to reduce competition. We can encourage mastery goals and intrinsic motivation, defining success as progress, as opposed to maybe getting an A or completing whatever sporting event. And the idea that mistakes are natural and something to be learned from, an opportunity for improvement. A lot of shame lies around individual differences, whether it's in body, form, or race, or lots of different things. So being respectful of those. Giving the message that acceptance does not hinge on performance. So, big message for parents, but coaches and advisors and teachers. Trying to eliminate bullying and people picking on each other in spite of social media. In terms of step number 2, you can watch for maladaptive coping. If people are getting angry at others, again, why? Angry at themselves, you can ask why. What does this mean? Why is this so bad? When people drop goals, you can sort of question why. You can model adaptive coping, and I think that's true of anybody in a leadership position, certainly in classes, and when I make a mistake, I try to handle them gracefully and try to acknowledge the limits of my own knowledge as opposed to faking it. I did create a shame scale. It's a self-report survey, paper and pencil type thing. Takes about 5 minutes, and this has been translated to 16 languages. So this is where we've collected a lot of our data from around the world. So some take-home messages are that shame emotions are clearly adaptive. Again, self-conscious emotions, all of these. Doesn't necessarily mean that you're a bad person. It could be the other person judging you. We can minimize it and encourage adaptive coping. And it's often okay to let yourself off the hook. So my image here at the bottom right is that funhouse mirror. Sometimes I feel bad about myself because the eyes that I'm being mirrored through are warped. I tell my students, if your parents think that you're a terrible kid because you get nothing but, or not anything less than an A plus, well, that's not a very good mirror that you're looking in. So here I'm being speculative, well, somewhat. Actually, there's quite a bit of literature that people don't seek help due to embarrassment. They don't go to doctors sometimes, depending on the health-related problem. Athletes and other people feel embarrassed because they got injured. I did something stupid and twisted my ankle, or I overtrained, not following health or recovery guidelines. I went through surgery and then I messed up the recovery, misdiagnosis, ineffectual treatments, and pretty much any other mistake that's out there. So that's the end of what I wanted to present, and I think this is a good jumping off point because you all have much more experience with this than I do, this part of it. So yeah, any questions?